Hello, everyone, and welcome to part two of Amberlynn Reid's traumatizing ER extravaganza. I would like to give a little bit of a sensitivity warning before we start. Um, as Amber is telling her tale of woe in the ER, I interject with three of my own. Um, and they are a little bit graphic. If you can't handle that stuff, then be ready to hit the fast forward. Um, anyway, as I like to say, brevity is the soul of wit, so let's just dive right into this dumpster, shall we?
So I just got out of the hospital. I woke up with really bad pain on my left side
Yeah, get you some sympathy views, baby.
in my back. And when I breathe in, it's like this sharp pain and it feels horrible.
She probably pulled something.
I called my doctor just to make an appointment, but they said there's no available appointments.
Because you live in a big city and you probably see one of the doctors that has like lower income patients, and they always have a full office.
And with your symptoms, you need to go to the ER. I ended up going to the ER and they're glad that I did.
I'm sure that those medical professionals are glad that you, Amberlynn Reid, went to the ER.
Me too, because when you have symptoms like that, especially because it felt
Amber, please learn how to pronounce the word especially. I have seen you pronounce it with the X sound, even when it was spelled out right in front of you and you were reading a paragraph with the word in it. Why is it so hard for you to just say especially? It is not cute. It is not quirky. It does not make you unique. It makes you look really fucking stupid.
like I was also short of breath. Breathing in was hurting
Breathing in was hurting, so she didn't want to do it because Amber never does anything uncomfortable or painful.
really bad. So it's like something could be wrong with my lungs, or they even said that it was like possible heart attack. So
I accidentally cut this out. Ankle Rolls Reed pointed this out really well. She smiles. She looks out the window and she smiles when she says it could have been a possible heart attack. Um, I am an older person. I am about to be 48 years old, and I have not been kind to my body. When I was in my very early 20s, I was on a combination of diet medication and also in a very bad relationship. And I had a heart attack. And it was really fucking terrifying. And I still feel lucky to be alive, and I celebrate being alive. I've also had an embolism, and I almost lost a pinky toe. And the doctor told me that I was pretty fucking close to having a stroke too. And I got lucky because they saved me, and they saved my little pinky toe. You know, it still turns purple and it still hurts and it still goes numb once in a while, but they told me to expect that. And because of that, I modified my life. I no longer drink. I have cut back on my tobacco usage a great deal. I have not quit yet, but I am aiming to, and I am slowly weaning myself off of it. But yeah, these health scares, they scared the shit out of me, and they made me change my lifestyle, and they made me live a better life. And Amber just looks out the window and smiles, and she probably cut out a fucking giggle too.
they gave me an EKG, as you can still see. I
Yeah, because you left them on because you need the attention, sweetie.
haven't taken any of them off. I also have some on my stomach.
You know, you could have asked the nurses or tech to help you take them off. They could have just, rubbed you up with a little bit of rubbing alcohol and boop, right off. Took a matter of seconds.
And thankfully, the EKG was perfect.
Sure it was, Amber. Sure it was. You're well over 400 pounds. Sure, that EKG was perfect.
I got my blood taken, which I have a whole story with that, which was honestly so terrifying.
Oh boy, here, we're in for it.
You guys will never, ever believe what happened. I am a mess. I don't
Sure we won't.
know what to do with myself.
Amber, you've already said that earlier in this vlog, that you don't know what to do with yourself and you're a mess. Nothing's changed except now you got little EKG sticky tabs on your chest and you're begging for some fucking sympathy.
Currently not wearing a freaking bra because I had to get it. Freaking lady took it off because
The friggin' lady took her bra off. The friggin' lady, the x-ray tech, the nurse, the orderly, who took your bra off? And the reason that you have not put it back on yet, my dear Amberlynn Reid, is because you can't. You are incapable, Amber, of putting your own bra on by yourself. And you were incapable of taking it off by yourself to have an EKG and a chest x-ray, Amber. And that's what you're mad about. Well, at least I hope that's what you're mad about.
I got an x-ray of my lungs, which my lungs and my heart look normal. So
Sure. Your heart and your lungs look normal.
story short, they're really glad that
Long story short, I cut this fucker down deep.
I went in because the symptoms are, scary. But since everything looked normal, turns out I just have like a strain, like a really, really bad back strain.
I called it.
Which is so weird to me, so crazy. So
It's not so weird, so crazy, Amber. You're over 400 pounds. Any little movement could fuck your whole goddamn day up. Any little wrong movement.
made an appointment with my doctor for next week. I'm glad I went. Now I don't feel as scared. I don't know how I straightened
You need a drink of water, girl.
my back. I guess
She don't know how she strained her back.
it could have been because the ligament thing.
The ligament thing for the ankle injury that she said she was never going to mention again, but has mentioned in every single vlog since she said she was never going to mention it again.
And I, laid up in bed for a while. And
a while, entirely too long, way longer than you needed to. And you milked it for as much sympathy as you could.
like how I had to maneuver myself was very different. And
how she had to maneuver herself with an ankle injury is very different than how she had to maneuver her massive 400 and some pound girth. Okay.
I guess it makes sense, but it's still scary. So
yeah, it should be scary. It should be scary enough for you to do something about it.
On the way
other than bitch.
To the x-ray room, I was walking through the halls. They asked if I wanted to use a wheelchair and I said no because why?
Here. No, she didn't want to use a wheelchair. She went to the ER in severe pain in her lower back left side. So bad she went to the ER, but she didn't need to use a wheelchair because why?
I don't need one.
She don't need one, but she was in severe pain enough to go to the ER.
But I ended up using a wheelchair, and I'm about to tell you why. I was walking and I had my IV, and all of a sudden, as I'm walking, I heard something fall and I didn't know what it was. And then I just felt this hot, weird feeling go down my arms, and I looked and the freaking IV fell out of my arm.
Hot, weird feeling go down her arm. Pain?
And I was gushing blood all over me. Oh my God, it was.
I wonder if they put her on blood thinners because it just seems odd. I have a long sordid medical history. I am 20 years post-gastric bypass. I have had 2 hernia surgeries. I have a great deal of bowel issues. And I am really rather accident prone, as people go. And I have had quite a number of mishaps with IVs. My very first, the very first really bad mishap with an IV was after my gastric bypass. They had the IV in my left hand on the top of my hand because, I was really obese and it was hard to find a fucking vein. So, I don't know, something got into the needle or on it, and it was like, it was not very clean. So my hand got infected and it swelled so big. It was like a giant, like somebody blew up a rubber glove. My hand was so swollen I couldn't move my fingers. And they had to drain it. And this was like the day after my gastric bypass. And also I stopped breathing during the surgery and I had to be resuscitated. My heart stopped for 2 minutes. Another time, here's a fun story. I had my first hernia surgery in 2010, and I have an overactive bladder. And when I am stressed out, my bladder just shrinks to the size of a walnut, and I have to pee constantly. I have to constantly just get up and pee, even if like I am deprived of fluids. So, anyway, after my hernia surgery, I had a catheter in, and I had to get up and have the catheter removed to go to do physical therapy and do some bending and everything and make sure that, I didn't get a blood clot in my legs. um, so they took the catheter out and I told them, hey, you might want to put this back in because I was going to be in the hospital for quite some time. And they said, no, you need to walk around. It's okay. We will come. Just ring us. We're here. It's all right. And, I was like, okay, they're professionals. They know what the fuck they're doing. I'm not going to bother them. It's their job. So, yeah, it was basically every hour I had to pee the first day after they took the catheter out. And after a while, they got tired of coming to handle me, and I got tired of bothering them. So I decided I was going to get up and go on my own. And my heart monitor and the pulse thingy, I don't know what the fuck the machine is called, was also on the same pole as my IV bag. So I lumber out of bed and I yank the plug out of the wall and I tell the nurse, it's okay, I'm just going to the bathroom because, it started beeping. And so I make my way to the bathroom, and as I'm walking, I'm like so out of it because I'm in so much pain. As I'm walking, the IV pole is kind of spinning, and I'm not really paying attention, just because I gotta fucking pee. And I ripped the IV out of my arm, like the tape and the everything. And it was like one of those little plastic, I guess they're silicone, but they're really thin, floppy needles. They put it in with a metal needle underneath it, and then they pull the metal needle out, and it's just this little like silicone port in there and then they can change the IV bag a little easier. Anyway, yeah, I ripped all of that out. And it hurt so bad. My whole lower arm went completely fucking numb after that. But there was no blood. There was really literally maybe a drop of blood, and I was like, oh fuck, now I really gotta call the nurse and they're gonna be pissed off at me now. There was also another time that after an accident I woke up in a great big crazy confusion, and there was all these lights and people in white and masks, and I ripped the IV out of my arm in the emergency room with a concussion, and had to be restrained. Yeah, and still not gushing. Which makes me question, is our dear girl on some blood thinners?
All over the floor, and the way that they reacted was so calm, so collected.
It's their job to be calm and collected. It's like literally part of their job description. They're trained for it, honey.
like 6 different people like that worked there from like 6 different areas just like came, cleaned up the floor real quickly.
That's odd. That's odd that if she was on her way to get an x-ray or on her way back from it, sorry about that, my cat just knocked something over. If she was on her way to get an x-ray or come back from it, why did they make her stand around long enough for 6 different people from 6 different departments to come and clean up her bloody mess? Seems a little sussy to me, sis.
Started crying because I was scared. Like, I've never had anything like that happen. It was like blood was just everywhere.
Sure, Jan.
All over my arm and hand and all over the floor. But they quickly cleaned up part of my arm. I still have a lot of blood on my actual upper.
Why didn't they clean up your whole arm, dear? And that little flash you gave us, I saw nothing.
Arm, but I'm not gonna like show you guys that. And it
because there is none.
was just gushing. I don't know how it fell out. I'm thinking maybe it was part of my cardigan, like pushed it out.
Why wasn't she in a hospital gown? She's in Kentucky and they grow them big there, so they got bariatric hospital gowns. And she could tie 2 of them together. When I was a big girl, I had to have 2 of them tied together.
Slash, when you're walking, your blood pumps more, so it was just like the mixture of everything.
I think that you're just exaggerating, dear.
It was so traumatizing. Like, it was just scary. I was already having a lot of anxiety. Obviously, like, you're at the hospital.
She is so sensitive and so inexperienced with life that every little thing is traumatizing, nerve-wracking, and too fucking much for her. And that's really sad. I would hate to have to live a life like that.
Scared. But yeah, they were just really, really nice, kind. That
it's part of their job too.
If that would have happened to anyone, you guys would have been scared. Like,
not really. I'm pretty fucking cool with things like that. But again, I'm old and I'm accident prone, and you know, my family are medical professionals.
Honestly, I can be dramatic, but I feel like sometimes it's very validated.
It's not very validated to be dramatic all the fucking time and exaggerate and lie all the fucking time just to get views and clicks.
So it was just traumatizing and gave me a little bit of PTSD because
we all know how absolutely ignorant that just was. It gave me a little bit of PTSD. She has no idea what post-traumatic stress disorder actually entails. And she just throws it around again, like, we went to Walmart.
Like, before I got diagnosed with cancer, when I was like rushed to the ER and there was blood like everywhere in the hospital.
Here, she's saying blood everywhere in the hospital, but for years and years before that, she was bleeding nonstop every single day, and that didn't traumatize her. That didn't motivate her enough to take care of herself.
Because of me, and it reminded me of that. There was blood everywhere in the hospital because of me again, and it was just like so traumatizing.
It probably wasn't everywhere in the hospital, dear.
And I don't know, it was an experience. So
yeah, it was an experience, but you know, people have experiences to one degree or another, and that was a pretty lesser experience.
I do anything labor, like walking, oh my god, it hurts so bad because like
well, Amber, you're over 400 pounds. Of course walking's gonna fucking hurt.
Obviously high, I'm bigger, so I breathe heavier and more when I
now it's about her weight, but the fall wasn't about her weight. But this is about her weight. But probably not the back pain or the chest pain. That's not about her weight. She's going to say that's not, because skinny people have chest pain and back pain too.
Do laboring activities, even something as simple as just walking.
Amber, you don't want to do anything that is uncomfortable or labor intensive or anything at all that means that you have to exert yourself or do any kind of work.
So thankfully a wifey went into the pharmacy for me, and that's where she's at.
A lot of people have already pointed this out, but Amber has been calling Jade, or whatever her name is, wifey, in the last few videos. And we all think that it is a derogatory move because she went off on her viewers previously. We're not allowed to call her wifey because that's not wifey. That's not who she is. This is a totally different girl. This is my girlfriend. This is Alex. This isn't wifey. Stop calling her that. I'll block you.
Right now, and she's giving me medicine because they prescribed me something called lidocaine. It's like a lidocaine patch.
Correct me if I'm wrong, please do. But I honestly thought that lidocaine was for like surface level pains. Like, you know, a little bit of nerve pain on a topical area of your skin rather than like deep tissue or muscle pain or strain. Because I thought that it just numbed you in a little spot and it didn't go that deep. And she's a very large girl. I don't think that it would go all the way down into her musculature.
Put on me, and my blood pressure was a little elevated.
And I wonder why they just gave her lidocaine. Why didn't they give her like the good? Does she go to that ER often and get nice pills?
I guess a lot of people who go to the ER, their blood pressure just automatically is a little bit higher than normal. My blood
Yeah, it's called stress.
pressure was 148/88.
That's really high, Amber. That's not a little elevated. That's really high.
It's a little elevated. My pulse was 82. You know, oxygen saturation was
82 beats per minute or per second.
97%.
That's pretty good for a person her size. 97% oxygen saturation. I'm a very small person, and I don't get very good oxygen to my veins, which is why I had the embolism.
But yeah, they did the EKG.
Well, no, I had the embolism because I had a blood clot. And they didn't call it a blood clot, they called it a blockage. And then they put me on cholesterol medication and told me to stop eating sticks of butter. No, I'm kidding. I don't eat sticks of butter. My husband accuses me of eating sticks of butter, but I do eat a lot of fatty foods because I fucking love them. And that's hard to give up the bacon. I dialed back the bacon. I don't give up the bacon.
The chest x-ray took my blood, and everything looked completely normal and perfect.
I find that really hard to believe, sweetheart.
So,
I mean, what is your definition of normal and perfect? Where's your baseline? Where is your baseline of normal? Where is Amberlynn Reid's like Scranton reality anchor here? Sorry for bringing up SCP Foundation stuff, but where is Amberlynn Reid's reality anchor? You know, where is your baseline, sweetie?
I'm really glad about that, but today's been a day. I don't know. I just wanted to update.
Yeah, every day is a day.
You guys on that. Like, this is real life. I have an appointment next week.
Are we sure it's real life? Because you're looking around like a paranoid lunatic waiting for somebody to come to the car. Like, oh, you're going to have to stop talking as soon as she gets to the car. Is it real life?
With my doctor, thank God, because your girl was scared. Like, to wake up and
She's scared enough to start singing about it.
feel that way. It honestly felt like
I'm 48 years old. Well, I will be 48 years old this month. And I have woken up feeling quite some ways over the last few years, especially since my embolism. I worry a lot. And I put myself in a lot of self-induced stress. I got to work on that. And I have a lot of chest pain. And I should probably, you know, go see a specialist about it. But in the last few years, I've had a lot of chest pain, and it has made me rethink my life, rethink my diet, well, actually change my diet a great deal. I hope that this is the wake-up call for Amber, but the cancer wasn't, the dangling ankle wasn't, and nothing has been so far. So we shall see.
like something was wrong with my lungs. And they gave me a little bit of medicine while I was in there. It's kind of worked. They put it in my IV, and
I guess they did give her good painkillers. Because I don't know what other medicine they could give her that would make the pain go away. That wasn't just a fucking painkiller.
after my IV fell out, I said, I don't want it back in. And they didn't have a reason to put it back in, so thank God.
It's odd that she needed the IV in the first place. Was she dehydrated? What?
You know, it's just more shit that I have to deal with and just be strong, and it's just queen shit, okay?
It's not queen shit. I already outlined what queen shit would be for you, Amber.
Just have to go through things to be stronger, you know?
Wow, so while I was editing this video, it seems our girl posted a new one updating us on her health issue. And it is quite a lot worse than a strained back. I hope that this is the the scare that she needs to finally get her shit together and work on honestly really getting healthy, because having a partially collapsed lung is pretty fucking bad. You could anyway. Yeah, so I'm just gonna end this here, and I'm gonna take a break for a little while and work on something different. I'll see you guys in the next one. Bye.